Hi, my name is Denisha Bullock, and this presentation is on the relationship between medication and depressive symptoms. Depression. Depression is characterized as feeling of sadness, despair, and a lack of interest in life, and associated with high disability. Depression can be expressed in many ways, and it varies from person to person. And to um, to evaluate depression, there are many different instruments, such as the Hampton's Depression Rating Scale. Um, Today, many individuals develop depression or have depression symptoms that can lead to other measures such as suicide. However, there are many techniques that can be used to help manage such problems or symptoms. Medication or antidepressants. Medication is something that can be very helpful in managing, treating, or preventing symptoms. There are multiple reasons why individuals take medication. Some of the reasons are high blood pressure, diabetes, or depression. However, there are many issues that lies within usage or even prescriptions. Um, some people take multiple medications, or they have a medication that has multiple purposes as well. Like I mentioned before, there are a lot of complications when it comes to medication. There are issues that can be made by doctors, such as writing the wrong dosage or the wrong drug, or prescribing the incorrect duration of treatment or wrong formulation. There can be also complications in the pharmacy or pharmaceutical system, such as pharmacies misinterpreting doctors' prescription or not giving advice to patients when they're getting their medication. There has been research that suggests that pharmacy can contribute to the rise of effectiveness by having dispensing errors, of which with dispensing errors, patients can be given the wrong dosage as well. Um, there could be misinterpretations of doctor's prescriptions due to the doctor's ineligible handwriting. Um, Medication adherence. Females are less likely to be adherent when taking medication for diabetes or cardiovascular disease. Females are also less likely to get recommendations. There are generally recommendations made to other patients. And women use one or more medication as well. Um, Such factors like hormonal contraceptives that also plays a factor in why women use more medication. Review of depression symptoms. There are a lot of predictors of depression. However, in my research, I've seen that perfectionism and loneliness are two predictors. Research by Chang in 2017 suggests that um, different variations there are different variations in depressive and anxiety symptoms, and loneliness is greatly associated with greater depression. Um, Loneliness from an early age can impact African Americans as well. There also been studied by Danielle that suggests loneliness is not a predictor of depression symptoms, and that social anxiety symptoms are more predictor. Depression also has been found to be linked to conflicts with parents or conflict relations with a parent. Um, Parent youth conflicts is linked to a subsequent depression in adulthood, and there have been studies that early negative parenting increases the chances of developing depression. Depression comes along early in life during adolescent stage, and that can be due to changes such as social, psychological, and biological. Depression can start to develop in childhood and decrease from environmental factors at puberty. Gender also plays a fact in depression symptoms. Females experience depression symptoms that are at an earlier age than males, but both male and females experience an increase during adolescent stage, in which they're going through puberty and hormonal changes, which can increase depression symptoms. Um, in a study by Keys 2019, depression increased in 2018 for both genders from ages 13 to 18. However, the largest increase was in girls in 2012. Review of research studies on the relationship between medication and depression symptoms. Anti-medications. There are a lot of anti-medications such as Doloxine, Proxetine, Zoloft, Citrulline, a lot of different medications, and they are used to fight depression, but it also can be ineffective. The effectiveness of medication. Proxetine can reduce symptom severity and depression symptoms. It decreases depression after 8 weeks of treatment. However, it is not as beneficial as the Doloxine. It is very highly effective in treating depression, and there has been research that has stated that a higher dosage of Doloxine is very effective in treating depression and also OCD. The medication quickly changed mood, guilt, um, suicidal idea, things in that nature. For my methodology, I will recruit 300 outpatients with depression. That's either taking Zoloft, Agometine, and Doloxine. Respectfully, I would want 100 participants in each medication. Um, the individuals will be recruited from mental health centers in Henderson, North Carolina, or Oxford, North Carolina, and collections will end once the quota is reached. I will be able to get in contact with the with mental health center or counselors to be able to get in touch with the outpatients. A survey will be provided for the mental health center and counselors. And I'll provide an email containing the survey link, and it will be sent to the clients by the counselor or mental health center to evaluate the effectiveness of their current antidepressant and their medication usage or the adherence. The two different measures I will use is the Morsky medication adherence scale. It's the 8-item scale, and scores that 6 or higher means adherent. For the Hampton Depression Rating Scale, the scores range from 0 to 2 or 0 to 4, and normal range is in between 0 to 7. However, 20 or higher is classified as mildly severe depression. For my proposed data analysis, I would use the Morskin Medication Adherence Scale and the Hampton Depression Rating Scale. So they can be analyzed to evaluate a moderate to strong negative correlation. Now we use SPSS to analyze the relationship between medication and depression symptoms. Individuals with medication adherence of 6 or more are expected to score within a range of 0 to 7 on the Hampton Depression Rating Scale. Individuals who do not score 6 or more on the medication adherence scale are expected to have a lower score than the control group. And the control group is people who are taking their medication as prescribed. There can be other dependent variables such as age or gender that can be analyzed for a correlation to medication usage and depression symptoms. Thank you for your time.